How long will it take to get pregnant after Nexplanon removal or after removing any kind of hormonal birth control? That's different for every single person. Like, there's no way to know. I just got my Nexplanon removed today, and we'll see how long it takes. I'm not going to start trying it all for at least a month. I'm going to totally let my body reset. They say that you can get pregnant within 1 week of being off of the Nexplanon, and I've seen stories as well. Like, I've read different articles and Reddit and different things and done some research, and women were saying that they came off of this and that they were so fertile they got pregnant right away. And then others were explaining that it took them 2 cycles, that they waited a full 3 months, and they gave their body an entire month to just rest and reset. And then they gave themselves 2 cycles, and by the second cycle, they were pregnant after coming off of this. There's other people who it took a lot longer than that. And so I think every woman is different, and it just really depends on, one, how long these hormones are staying in your body, because you don't want to get pregnant right away when you still have these hormones in your body. I was reading one article of a woman, and she said that she got pregnant right away, like within 2 weeks of taking her Nexplanon out, and then it ended up being a chemical pregnancy. And so, you know, when the hormones are still in your body, it can cause some issues, which is why the doctor says, like, at least wait 1 full cycle before you actively start trying. Because when you have these type of chemicals and hormones in your body, it can cause things like ectopic pregnancy, meaning that the egg implants either like in the fallopian tube or somewhere outside of the actual uterine lining where you want that egg to implant, and then baby starts growing, and it can cause all kinds of problems like your fallopian tubes to burst and things like that. And so that's why you don't want to get pregnant with these type of hormones in your body, because it can cause things like ectopic pregnancy. I have decided to be really open about my journey with trying to get pregnant, and that started with today when I removed my Nexplanon. And so I'll definitely keep you guys in the loop when I start trying, and probably when we conceive. I'm imagining that I'll show you the pregnancy test, and you know, me and my husband were talking about it, and he's like, you can't just share like all the good stuff and the positive stuff, like what happens if you have a miscarriage. You know, a lot of people don't want to share their pregnancy until they're out of the first trimester, because that's when there's an increased risk of miscarriage. And the more I got to thinking about it, the more I just want to be, I guess, open about the journey and to share the good and the bad, and like just like the truth, and just be like so authentic about how long it takes me and the journey and my hormones and the process of just like getting my body ready for pregnancy. I am 32 years old, and so I'm not having a baby in my 20s. And I know in your 20s, your fertility is much, much higher. And then as you get into your 30s and up towards your late 30s into your 40s, it just continues to decrease. And so I don't know what I'm going to experience, but I know I'm a labor and delivery nurse, and so I know there's tons of moms that I've seen in their 30s coming and having healthy, beautiful babies, beautiful pregnancies with no complications. And so I know that that's possible for me, and I know it's also possible for you if you're in your 30s and you're trying to conceive and you're wondering like, how is my fertility? And you're putting a time clock on yourself. We do that when we're in our 30s because we feel like time is running out. But let's get that thought out of our mind, because time is not running out. That is definitely just a fear and just like a subconscious belief, because everyone keeps putting that into your brain that, you know, you're in your 30s, so you better hurry up and things like that, when it's just not true. Like, I've seen so many women in their 30s have healthy, beautiful babies and no genetic disorders, and it's totally and 100% completely possible to have a normal, healthy pregnancy and to get pregnant in your 30s. And honestly, I've seen it. It's so much more common now for women to live their life and to travel and to just wait until they're in their 30s to have a baby. So let's normalize that a little bit and stop making women believe that if they're not in their 20s that they can't have babies anymore, because it's just not true. After the removal of the Nexplanon, your period can return within a week, but it could take up to 3 months to return. And a reason to visit your doctor and start looking into what's going on is if you get this removed and you do not get a period, like it's been 3 months, still no period, that would be a reason to go talk to your doctor. I want to read this straight from Nexplanon's website because we're specifically talking about the Nexplanon in this video. And it says right here, you may become pregnant as early as 1 week after the removal of Nexplanon. After Nexplanon is removed, and if you do not wish to get pregnant, you should start another birth control method, such as condoms, right away. So even on their website, like they're saying, once you take this thing out, you can get pregnant. They also talk a lot on their website about how this is only good for 3 years. And after that 3-year mark, like you should use another form of birth control if you don't take it out right away, and if you take it out right away, obviously, but you have to use another form of birth control because they don't guarantee it past that 3-year mark. The Nexplanon works by stopping ovulation and also like thickening the cervical mucus, and so the sperm can't get up and implant the egg. And so it does that by releasing progestin, which is a synthetic hormone that mimics progesterone in our body. And so this little implant, it just keeps you from ovulating. And so once the implant is removed, you can start ovulating again within, 3 weeks. 3 to 4 weeks, you could have ovulation. And if that does happen, then you could get pregnant. There are some women who said that they got pregnant right away after taking the device out. So from the research that I've done, and you guys please correct me if I'm wrong in the comments, because obviously I have not tried to get pregnant. I literally just got my Nexplanon removed, and so I have no idea how long it's going to take me to get pregnant. But from what I've researched, it does not affect your chances of getting pregnant, like whether you have the Nexplanon and have it removed or if you didn't have it at all. And so research has shown that generally it takes women, on average, every woman is different. It could take women right away, they're just like fertile myrtle and get pregnant right away, and then other women it takes years and they just like can't get pregnant. But on average, it takes women 6 months to get pregnant. And that research does not change whether you had the Nexplanon or not. And so the research is actually showing that it doesn't decrease your risks of not getting pregnant if you previously had the Nexplanon. As long as you just wait 1 cycle, you can get pregnant right away and go straight back to your normal, natural cycle. The bottom line is that you can get pregnant right away after the removal of a birth control implant like the Nexplanon, and it could take 6 months or it could take longer. It just really depends on your body and how fast your body flushes out those hormones, and if you have anything else going on within your body. That can also affect your fertility. But I will keep you guys updated. I don't know how long it will take me to get pregnant. Again, I'm not going to start trying until at least 1 more cycle. But hopefully, fingers crossed, it happens for me. Follow along if you want to keep up with the journey. I'm going to be providing all kinds of updates. I hope you take the time to subscribe to the channel, to like this video, and also to connect with me by just giving me your perspective or asking me any questions in the comments. I love you guys, and I'm so excited to start this journey, and I'll see you in the next video. Bye.